men or women, whose brain is more active. The Amen Clinics, Newport Beach, California studied 46,034 SPECT images of brain, provided by 9 neurology clinics. SPECT, single photon emission computed tomography, is an essential functional neuroimaging tool, used for precision treatment of brain disorders, based on measuring the blood flow of brain. Images acquired from subjects at rest or while performing various cognitive tasks will show different blood flow in specific brain regions. This is the largest functional brain imaging study to date, quantifying differences between the brains of men and women. The study is published in the Journal of Alzheimer's Disease on August 4, 2017, Gender-based cerebral perfusion differences in 46,034 functional neuroimaging scans. Daniel G. Amen, psychiatrist and founder of Amen Clinics, is the lead author. The study identifies specific brain differences between women and men. The quantifiable differences identified between men and women are important for understanding gender-based risk for brain disorders such as Alzheimer's disease. The brains of women are significantly more active in many areas of the brain than men, especially in the prefrontal cortex and the limbic areas of the brain. The prefrontal cortex is involved with focus and impulse control, and the limbic or emotional areas are involved with mood and anxiety. But the inferior occipital lobes, inferior temporal lobes, and lobule 7 and Crus 2 of the cerebellum, the visual and coordination centers of the brain, are more active in men. Subjects included in the study are 119 healthy volunteers and 26,683 patients with a variety of psychiatric and neurological conditions such as brain trauma, bipolar disorders, mood disorders, schizophrenia, psychotic disorders, and attention deficit hyperactivity disorder. A total of 128 brain regions were analyzed with SPECT for subjects at baseline and while they are performing a concentration task. Understanding these differences is important because brain disorders affect men and women differently. Women have significantly higher rates of Alzheimer's disease, depression, which is itself a risk factor for Alzheimer's disease, and anxiety disorders, while men have higher rates of ADHD, conduct-related problems, and incarceration by 1,400%. Precisely defining the physiological and structural basis of gender differences in brain function will illuminate Alzheimer's disease and moreover a good understanding of the partners. The study findings of increased blood flow in limbic areas of the brains of women explain why they are more vulnerable to anxiety, depression, insomnia, and eating disorders. Increased blood flow to prefrontal cortex in women compared to men give them greater strengths in the areas of empathy, intuition, collaboration, self-control, and appropriate concern. Thank you.